So I just did a drive-by admission, and if you don't know what that is, it's when we are trying to go see a patient, but we cannot get a hold of them. They're not answering their phone. We've tried multiple contacts, and we end up driving by their house, knocking on their door unannounced, and seeing if they're home. So I want to talk about my boundaries that I have with doing a drive-by visit. And really, so number one is, where is this visit located with other patients that I'm seeing that day? If it's like 10 minutes or less outside of my way, then I usually will consider doing a drive-by visit. If it's like 30 minutes, I'm not going to drive 30 minutes to go see somebody that may or may not be home and then drive 30 minutes back to see my patients. Number two is really the safety aspect of it. So let's say they are 10 minutes or less, it's not outside my way too much, and I will look at I will read through the hospital notes, the coordination notes, and kind of get a feel for who I might be going to see, as well as I'm like either Googling their address, or if I know the area that they're in and I know it's usually generally a safe area, then I will potentially consider it. That being said, let's say I go drive by and I have to go through any sort of gate to get into the patient's house, I'm usually not going. Or I drive by and it's an unsafe neighborhood, I don't feel comfortable, I'm not going to get out and go knock on a stranger's door. Usually I will drive by if it's like an apartment complex, assisted living facility, independent living facility, something like that. I will usually go and try, as long as it works out for my schedule, and that now I'm going and seeing an admission, which adds, an hour and a half minimum in home time. And that can be difficult if it's in the middle of your day, because you show up, they're there, now you're with somebody for an hour and a half, and your next subsequent patients, they're waiting on you, or you're telling them a wider range of what you're normally doing, or you show up, they're not there, and then you're having to go see your patient. So it can be a little bit difficult if it's somebody in the middle of your day. Usually if it's the end of the day, that really helps. You drive by, they're not there, you go home. You drive by, they are there, you do the visit, and you go home. Not a big deal. So this is kind of my personal boundaries of what I will do for a drive-by visit. I know that some people will go like no matter what, and I know some people it's kind of a hard stop, they're not going to go at all. So you just kind of have to figure out what's going to work best for you and what you want to do personally to do a drive-by visit. And for me, it's really a case-by-case basis. I will look at all the different factors that go into this visit if I feel comfortable or not.